Okay, anatomy mock abdomen. We are starting with station number 8. You can see this diagram.
Yeah.
From this diagram, identify aorta, vertebral level, and surface marking. Surface marking, no need. Identify the aorta.
Yeah. So the
Just there will
red
be actually another picture where aorta will be very visible. You need to identify the aorta. Then vertebral level.
number A is the aorta. Then vertebral level is a T12 to lumbar 4.
Okay, and surface marking.
Surface marking 4 centimeter above the transpyloric plane to the supracrystal line.
Okay, identify the branches supplying GIT.
Celiac trunk, superior mesenteric artery, inferior mesenteric artery.
And what are the posterior branches of aorta?
Lumbar artery, median sacral artery.
What are the lateral branches of abdominal aorta?
Lateral branches are renal artery, right and left renal artery,
Mm-hmm.
gonadal artery.
Okay. Anything else? From
Renal
the very
artery,
from the very
suprarenal.
beginning. Okay. Tell me the branches of abdominal aorta from up to down.
Okay, so abdominal aorta is the celiac trunk, superior mesenteric artery, inferior mesenteric artery, right and left renal artery, right and left gonadal artery, hepatic artery.
Hepatic artery, is it? Abdominal aorta. Hepatic artery is the branch of abdominal aorta. Are you sure? Hepatic
No,
artery is the branch of
artery is from the celiac trunk.
celiac trunk. What are the other branches of celiac trunk?
Common hepatic artery, left gastric artery, and splenic artery.
Mm-hmm. Okay. Inferior vena cava tributaries.
It's the common iliac vein, right gonadal vein, right suprarenal vein, renal vein, hepatic vein, inferior phrenic vein, lumbar vein.
Okay. What are the structure passing in front of the aorta?
The celiac trunk, superior mesenteric artery, left renal vein, splenic vein, body of the pancreas, third part of duodenum, and root of mesentery.
Okay. And you can see this is a angiogram of the aorta. Now you identify the branches from starting from A to the end.
So number A is the aorta, abdominal aorta. Number F is the splenic artery. Number G is the
Serially. A, then B, C in this pattern. A,
abdominal aorta, then B right common iliac artery, C left common iliac artery, then
mm-hmm,
D is the left renal artery, and E is the right renal artery.
mm-hmm, F,
F is the splenic artery,
G,
G is the common hepatic artery, and J is the left hepatic artery, and K is the right hepatic artery. I is the gastroduodenal artery, and H is the superior mesenteric artery, L is the inferior mesenteric artery.
Okay. Okay. You can see another picture with a blue color arrow. What is this?
Is the infrarenal saccular abdominal aortic aneurysm.
What is aneurysm?
Aneurysm is defined as abnormal localized dilatation of the blood vessels more than 1.5 times than normal diameter and caused by weakness of the blood vessel.
What are the risk factor of aneurysm?
Risk factors: hypertension, hyperlipidemia, diabetes mellitus, smoking, family history.
And what are the causes of aneurysm?
The congenital cause like Marfan syndrome and acquired secondary to atherosclerosis, traumatic, horse riders, infectious syphilis, inflammatory cause.
Okay. What is the pathophysiology of aneurysm? What are the types of aneurysm?
True aneurysm, false aneurysm.
Hmm. And pathophysiology for true aneurysm.
True aneurysm is the median cystic necrosis due to loss of structural protein of the blood vessel, especially elastin and collagen in the media.
And false aneurysm.
It is caused by post-traumatic.
Okay. What is the difference between aneurysm and dissection?
Dissection,
Mm-hmm.
dissecting aortic aneurysm, is
Yeah,
it?
yeah. What will be
So
the
is the
change?
separation of the layers of the arterial wall with propagation of dissection proximally and distally.
Okay. And so what is the difference between aneurysm and dissection?
Aneurysm is the abnormal dilatation of the blood vessel
Okay.
and it can be localized. And dissection is the separation of the arterial wall.
Okay. So mainly, it is better to answer in this way. In aneurysm, there is no extravasation of blood, but in dissection or dissection, there is extravasation of blood and there is propagation proximally to distally.
Okay.
They want to hear this answer. Okay. We'll proceed to the next. Okay. Now, in this picture, demonstrate pyloric plane on a subject.
Pyloric plane is the halfway between jugular notch to upper border of symphysis pubis, the lumbar one level.
Okay. And you can see this section. This section at which level?
From down,
At
down to
at
upwards.
at which vertebral level?
Sorry,
This picture has been taken at which vertebral level?
lumbar one.
Lumbar one. And you said this section has been taken from below. Why you're saying it is from below?
Right side liver.
Okay. Identify the structure 12, 1, 5, and 21.
Okay. So in here, 21 is the left-sided kidney. Number 5A is the liver. 5B is the inferior vena cava. And number 12 is the body of the stomach.
Mhm.
And number 1 is the pyloric antrum.
What is the space between abdominal wall and the liver?
Subphrenic space.
What is the space behind the stomach?
Leisure sac.
And locate the gallbladder on a subject.
At the angle between 9 costal cartilage and lateral margin of the rectus sheath.
Okay. Move your finger down this costal cartilage till the anterior mid-axillary line. What is the organ underneath?
Right lobe of liver.
Where does the left lobe of the liver extend on the surface anatomy?
It extends left fifth intercostal space mid clavicular line.
Okay. If it is stabbed in the epigastric regions from inferior to superior, what structures are at risk?
Stomach and left lobe of liver.
And if it pierces more, if the knife pierces more, you said stomach, left lobe of the liver, and even though if it goes more up, which structure it will damage?
Yes.
Sorry, diaphragm. It can invade up
Diaphragm.
to the diaphragm. Yeah. What are the boundaries of quadrate and caudate lobe? Quadrate lobe.
So quadrate lobe, right side gallbladder, left side fissure ligamentum teres, posteriorly porta hepatis, and anteriorly anterior free margin of the liver.
And caudate lobe.
Caudate lobe is the right side group for inferior vena cava, left side fissure ligamentum venosum, and inferiorly porta hepatis.
What structure separate right and left lobe of liver?
The anatomically falciform ligament, right upper and lower coronary ligament, right and left triangular ligament. And surgically, there is line between inferior vena cava and fossa for gallbladder.
What is the blood supply of quadrate lobe of liver?
Left hepatic artery portal vein.
Identify this structure 21 to 17, 13, 20, 11, and 5.
11 is the hepatic artery. Number 5 is the common hepatic duct. 20 is the portal vein. 2 is the quadrate lobe. 21 is the quadrate lobe. 9 is the gallbladder. And 13 is the inferior vena cava. 17 is the fissure ligamentum teres. And 16 is the fissure ligamentum venosum.
Okay.
Yeah.
What is the venous drainage of liver?
Inferior vena cava and hepatic vein.
And how much blood they carries in percentage? Which one
I didn't
carries
read
the
it.
Which vessel carries the maximum blood?
Inferior vena cava.
Hepatic vein.
Hepatic vein.
Okay. Identify falciparum ligament.
From which picture?
Here, this picture. You can see the picture.
Falciparum ligament. Oh yeah. Number 2.
Okay. What does it connect to?
Liver to anterior abdominal wall.
And how it is formed?
Two folds of parietal peritoneum.
What are the attachment of the liver to the diaphragm?
Is the falciparum ligament.
Only.
Falciparum ligament, upper and lower coronary ligament, right and left triangular ligament.
What is the attachment of the diaphragm?
Sternal part, gyphoid process of the sternum, costal part, lower 6, inner surface of the lower 6 costal cartilage. Vertebral part is the right cross, lumbar 1, 2, 3, and left cross, lumbar 1, 2. And between two crura, there is a median arcuate ligament, and medial arcuate ligament extends from the body of the lumbar 1 vertebra to the tip of the transverse process of the lumbar 1 vertebra, and lateral arcuate ligament extends from the tip of the transverse process of the lumbar 1 vertebra to the 12th rib.
Structure passing through the central tendon.
Inferior vena cava and right phrenic nerve.
What are the tributaries of inferior vena cava?
Common iliac vein, then right gonadal vein, right suprarenal vein, renal vein, hepatic vein, inferior phrenic vein.
What are the structure remain in porta hepatis?
Common hepatic duct, portal vein, hepatic artery.
Tell me the blood supply of stomach.
So is the laser sac right and left gastric artery, and greater sac right and left gastroepiploic artery, and fundus of the stomach short gastric artery. Right gastric artery from hepatic artery, and left gastric artery from celiac trunk. and left gastroepiploic artery from splenic artery, and right gastroepiploic artery from gastroduodenal artery, and short gastric artery from splenic artery.
Hmm. Okay, now from this picture, identify structure number 2
Two is the body of the stomach.
and identify parts of the stomach.
Number 6 is the fundus of the stomach. Number 2, body of the stomach. Then pyloric antrum. Number 18. Then number 19, pyloric canal.
Okay, venous drainage of stomach.
So left gastric vein, right gastric vein drain into a portal vein, and left gastroepiploic vein drain into splenic vein, right gastroepiploic vein drain into superior mesenteric vein, and splenic vein drain into short gastric vein drain into splenic vein.
Splenic vein drain into where?
Splenic vein drain into portal vein.
How portal vein is formed?
Splenic vein and superior mesenteric vein drains into portal vein.
And where inferior mesenteric vein drain?
Inferior mesenteric vein drains directly in the inferior vena cava.
Is it? No.
No.
Inferior mesenteric vein drain into splenic vein.
Okay, okay.
Identify pancreas.
So pancreas, number 3 is the head of the pancreas, number 9 is the neck of the pancreas, then body, then tail.
To which number is the tail?
I can see the number. Number 10, is it?
No, this is 16. You can zoom in.
Okay.
If prepared, you can zoom
No, yeah, you just mark in here, that's why.
in. Okay.
Because
And
of
what is number 19? Number 19.
it's the unseen process.
What is the development of pancreas?
Ventral bud, dorsal bud. So from ventral bud is the ventral bud developed from hepatic diverticulum and gives rise to uncinate process and lower part of head, and dorsal bud develop from dorsal part of the duodenum and gives rise to upper part of the head, body, tail.
Okay. What is the peritoneal relation of pancreas?
So head, neck, body is the retroperitoneal and tail is the intraperitoneal.
The blood supply of pancreas.
So artery supply superior, inferior pancreatic or duodenal artery and splenic artery. Pancreatic branches from the splenic artery. Superior pancreatic duodenal artery are from gastroduodenal artery, and inferior pancreatic duodenal artery from where? Inferior pancreatic duodenal artery,
Hmm. From
superior mesenteric artery arises
superior
from.
mesenteric. Yeah.
Okay.
And
Then
venous drain.
venous drainage is superior pancreatico-duodenal vein, inferior pancreatico-duodenal vein, and splenic vein.
Okay. Uncinate process gets supply from which vessel?
Inferior pancreatico-duodenal artery.
Describe the ductal drainage system of pancreas.
Main pancreatic duct, accessory pancreatic duct. Main pancreatic duct drains into uh, head, neck, body, tail, and opens into major duodenal papilla. And accessory pancreatic duct drains into uncinate process and opens into minor duodenal papilla.
Vessel present behind body of the pancreas
Splenic vein,
and space between pancreas and stomach.
the laser sac,
Vessel present behind the neck of pancreas.
portal vein,
Vessel present in front and behind third part of the duodenum.
so in front superior mesenteric artery and vein, and behind inferior vena cava, aorta, and right gonadal vein.
Okay, what is the peritoneal relation of duodenum?
So first part of duodenum is the intraperitoneal, and other parts of duodenum is retroperitoneal.
Okay. In which part of the peritoneum the hepatic artery pass?
Laser omentum.
Okay. Today it was up to here, or you finished the next part also? We are
Maybe.
now in page number 30, I think. Uh, we'll keep up to here today,
Okay.
and
Mm,
tomorrow we'll continue from the next.
okay.
Okay, you did
Thank
well. Actually, there is nothing to correct. You answered all the question properly. Okay, thank you, and we will conclude our session here. And tomorrow at the same time, we will start and we will continue from duodenum and the next.
Okay.
Okay, okay, good night.